In this work, we present an advanced collaborative virtual reality environment to improve several aspects of liver surgery planning and training procedures. The proposed environment allows multiple users either co-located or remotely to collaborate within the same shared virtual environment for improving team training and communication. The proposed environment supports photorealistic avatars, where users can generate their representation models from the 2D photos. A user management system allows the users to create their user accounts, avatars, and a matchmaking room. The virtual environment can be served as an exploration, planning, and training environment for laparoscopic liver surgery. It consists of 3 main rooms: a lobby, a liver surgery planning room, and a virtual operating room. After the users choose their roles, they will connect and form as a group in the lobby. In this room, they can introduce themselves, make a discussion, and explore the overview of the environment as well as the interaction techniques. For liver surgery planning, we developed a virtual room that supports various collaborative aspects. A curated set of 9 patient cases represent the most frequently occurring tumors in the liver, and a wide range of different complexities and characteristics are presented. There are 4 stations in the planning room: a virtual liver library, information board, DICOM board, and virtual resection planning. The selected patient case in the planning room is connected, and also used for laparoscopic liver surgery training, in the virtual operating room. We integrated a laparoscopic simulation with spatial input devices and training scenarios for interprofessional team training. This allows the users to perform the training with different user roles, including surgeons, camera assistants, and anesthesiologists. Therefore, they can train the critical and distracting events, where communication between each profession is necessary. Our proposed environment was evaluated in a pilot study with 5 surgical residents and 1 medical student. Qualitative feedback regarding features and usefulness for surgical planning and training was collected. The experts assessed the environment as an essential tool to evaluate and improve surgical planning as well as the training during critical situations of the surgical procedures. Our virtual environment connects users in different roles where they can improve their surgical skills and practice their communication and teamwork during various critical events. It also opens new directions for future operating room training and team collaboration.